The folds on the cerebral hemisphere are called gyri, which are separated from each other by a sulci, increasing the surface area of the cortex, which is approximately 2000 centimeters square. The formation of these sulci begin at the 5th to 6th month of the intrauterine life and ends at the end of the 9th month. External features of the cerebral hemisphere: superolateral surface is in relationship with the cranial vault. The medial surface is separated from the corresponding surface of the opposite side by the falx cerebri and longitudinal fissure. The inferior surface is divided into anterior orbital and posterior tentorial surface by the stem of the lateral sulcus. Borders include the superomedial border between the superolateral surface and the medial surface. The inferolateral border is present between the superolateral and inferior surface. Medial orbital border is the border that divides the medial and orbital surfaces. Medial occipital border is between medial and tentorial surface. The lobes of the cerebral hemisphere are divided by the central sulcus, which begins at the midpoint of the superomedial border and runs obliquely downwards to meet the posterior ramus of the lateral sulcus. The lateral sulcus divides the orbital and the tentorial surface on the inferior aspect. The parieto-occipital sulcus on the medial surface cuts the superomedial border in front of the occipital pole. The preoccipital notch is an indentation on the inferior border 5 cm from the occipital pole. The two imaginary lines finally form the four lobes. The first is formed by joining the parieto-occipital sulcus to the preoccipital notch, and the second is formed by the extension of the posterior ramus of the lateral sulcus to the first imaginary line. The poles of the cerebral hemisphere include the frontal pole, which is on the anterior end, the occipital pole, which is on the posterior end, and the temporal pole, which is anterior end of the temporal lobe. Divisions of these lobes are best appreciated on the superolateral surface. Lobes are separated by the central sulcus, which begins at the midpoint of the superomedial border and runs obliquely downwards on the superolateral surface to end a little above the posterior ramus of the lateral sulcus. Sulci and gyri on the superolateral surface. The central sulcus also cuts the medial surface, and the posterior ramus of the lateral sulcus extends into the temporal pole, whereas the anterior horizontal and the anterior ascending extend into the frontal lobe. A precentral gyrus lies between the central sulcus and the precentral sulcus. The area in front of the precentral sulcus is divided into the superior, inferior, and medial frontal gyri by superior and inferior frontal sulci. The inferior frontal gyrus is further divided by anterior horizontal and anterior ascending rami of the lateral sulcus into pars orbitalis, pars triangularis, and pars opercularis. Gyri and sulci of the occipital pole. The lateral occipital sulcus divides the lobe into superior and inferior occipital gyri. The superior and inferior occipital gyri are separated from the occipital pole by the lunate sulcus. Sulci and gyri of the parietal lobe. The postcentral sulcus runs parallel and behind the central sulcus. A postcentral gyrus lies between them. The area behind the postcentral gyrus is divided into superior and inferior parietal lobules by an intraparietal sulcus. Inferior parietal lobule is invaded by the posterior ramus of the lateral sulcus. The superior and inferior temporal sulci divide it into anterior and posterior parts. The anterior part of the inferior parietal lobule is called the supramarginal gyrus, and the middle part is called the angular gyrus. The superior and inferior temporal sulci divide the temporal lobe into superior, middle, and inferior temporal gyri. The area around the parieto-occipital sulcus is also known as arcus parieto-occipitalis and is separated from the superior occipital gyrus by transverse occipital sulcus. Calcarean sulcus near the occipital pole begins in converging rami and runs forward below the splenium of the corpus callosum and is joined at an acute angle